Did you know that a third of the children in Santa Clara County live in households that are food insecure? Hi, I'm Dr. Eliana Harrison, and I'm a pediatrician at Santa Clara Valley Healthcare. And today, I'm going to talk to you about food insecurity. We are going to learn what food insecurity is, what the implications of food insecurity are on the health and well-being of children, and we are going to talk about the novel ways that we address food insecurity in our clinic. The inspiration for this work is first and foremost our patients. We have seen the struggles of food insecurity in the lives of our patients every day, but we didn't have a good way of addressing it. And so today, I will be telling you about how we changed that. So what is food insecurity? It is the limited or uncertain access to enough food. 1 in 7 children in the United States lives in a household experiencing food insecurity, but 1 in 3 children in Santa Clara County does. And children in Black or Hispanic households are twice as likely to have food insecurity than white children. As I think you know, food is so much more than nourishment. It carries deep emotional meaning and often serves as a way for families to express love and care. So it's no surprise that food insecurity places a real strain on families and can contribute to toxic stress, forcing families to choose between food and other essential necessities. We know that food insecurity seriously impacts the health and development of children. Children experiencing food insecurity have higher rates of developmental problems, lower cognitive indicators, and more dysregulated behavior. They have higher rates of missing school and higher rates of school failure. Teenagers experiencing food insecurity have higher rates of depression, anxiety, and suicidal ideation. So we decided to treat food insecurity just like any other aspect of a patient's life that impacts their health in such a profound way. For example, if I know that my patient needs a heart specialist and medications, I place a referral and prescription in our computer system. And the heart doctor will call the family with an appointment, and the patient can go downstairs and pick up their medication that same day. It is so simple. So why should we make giving children nutritious food more difficult than that? We work together with our local food bank and our public health department to directly connect patients to long-term and short-term food assistance. We had previously just given a phone number for the patients to call, but we developed an active referral. An active referral is just like the other medical referrals that I mentioned. The food bank will call the family and go through the application process for long-term food assistance and connect them with locations of the closest food banks. The onus of connecting patients to food is on us, not the patient. With this established referral process, we can also use it to alleviate other financial stressors. For example, if patients don't have enough money for diapers, we can ensure that they have enough food so that they can shift to buying diapers. The next step for us to expanding this is to incorporate a food pantry in our clinic, similar to a food pharmacy. Families can work with a nutritionist to develop meal plans that work for their family and pick up the food in clinic that same day. We worked on establishing this robust referral process before we took the next step of asking families if they needed food. And I wanted to pause and highlight this because before asking families about food insecurity, we must make sure that we have the tools to help them if they answer yes. If we don't, then we erode the trust that we have built with families, and we also create moral injury for our pediatricians. So now, with this new referral, we can directly connect families with the 4 resources that can help improve access to healthy food. These resources are 1. SNAP, or Supplemental Nutritional Assistance Program, otherwise called CalFresh or an EBT card. It's available for citizens and most non-citizens with legal immigration status. 2. WIC, or Special Supplemental Nutritional Program for women, infants, and children, provides pregnant and breastfeeding women and children under the age of 5 with food. No immigration documentation is required. 3. Food banks. 4. Universal school meals. In the state of California since 2022, any school TK through 12th grade must provide 2 meals free of charge. The rules around these benefits and the amount of funding for these benefits is changing significantly, which I wanted to highlight because as we talk to families and recommend these food resources, we may be met with questions, one of which being the public charge rule. The public charge rule means that federal officials can deny entry to the United States or adjustment to lawful permanent resident status, like a green card, to someone that they determine to be a public charge, or likely to become dependent on government support. In 2019, the public charge rule was changed to include SNAP and non-emergency Medicaid. And then in 2022, this was reversed so that the public charge rule did not include SNAP and non-emergency Medicaid. This back and forth has created a lot of fear and misinformation around applying for these benefits. Knowing the current rules allows us to counsel families appropriately. In conclusion, food lives at the heart of so many families. Improving access to food improves the health and well-being of children. As you consider food insecurity in your community, I want to leave you with some next steps. On your own, you can read the AAP, or American Academy of Pediatrics, Food Insecurity Toolkit. You can read How the Other Half Eats, The Untold Story of Food and Inequality in America by Priya Fielding Singh. With minimal collaboration, you can improve your understanding of local food agencies and create more active referrals to both WIC and SNAP. And with major collaboration, you can co-locate your clinic with a food pantry, WIC office, or community worker to create seamless support for your families. Thank you for listening today and taking the time to improve food security for families and children.